Have been dispatched to a possible gunshot wound incident at a residential home. No further information at this time.
Okay, BSI in place. Is the scene safe? Has police secured the weapon?
Yes, the scene is safe to enter. They state that the patient was cleaning his handgun when it discharged. They have secured the weapon.
Okay, so mechanism of injury is a gunshot wound. Sounds like it's one patient. I'm going to request ALS. Police is already on the scene, and I'm going to consider C-spine.
There is only one patient. PD is maintaining scene safety and ALS is on its way.
Okay, so upon approaching the patient, he's supine on the floor. He doesn't seem to be moving. General impression seems bad. Sir, can you hear me?
The patient does not respond.
Okay, so we're going to check to see if he responds to painful stimuli and see if his eyes open to that as well. Sir, can you hear me?
Patient does not respond and eyes do not respond to painful stimuli.
Okay, so based on that, GCS is 3, and this is going to be a rapid transport patient, and like I said, general impression is definitely poor. We're going to check his ABCs and go from there. Okay, airway. While I check his airway, I'm going to ask my EMT assist to please put him on the pulse ox, end-tidal, and get a blood glucose. So airway, we're going to open his airway with a jaw thrust maneuver, look to see if there's any obstructions or secretions, and we're going to measure and see if the patient accepts an oral pharyngeal airway. I am going to look, listen, and feel for breathing. I feel breathing. I see adequate chest rise and fall. I'm going to check for pulses. Both are present. Respiration seemed to be about 16 and non-labored, and his pulse seems to be about 70, and both are present.
Patient has labored breathing. Rate is 22 breaths per minute. Patient accepts airway, no obstructions or secretions. Pulse ox reads 26 breaths per minute and 90% at room air. End tidal is 45, blood sugar is 80.
Okay, so based on that information, I'm going to put him on 15 liters non-rebreather mask, 100% O2, and continue with the ABCs. So I'm going to do a rapid sweep and check for any major bleeding.
Upon removing the t-shirt, you notice frothy blood from a chest wound.
Okay, so frothy blood from a chest wound. We're going to apply a occlusive dressing to the wound and tape that down on 3 sides. Okay, and did I get any bleeding from the sweep?
You noticed blood on your gloves when you swept his back.
Okay. I'm going to ask my EMT to go inside and see if he can get a sample history. In the meantime, I'm going to grab C-spine, put a C-collar on him, and right before I put him on the backboard, I'm going to sweep the back. I'm going to check the back to see where that blood is coming from. So we're going to grab C-spine, and then we're going to pass that off to my EMT assist, make sure that they do not let go, and apply a C-collar. Okay, at the count of the person on the head, on their 3, we're going to roll the patient over. Okay, 1, 2, 3. Okay, I'm looking on the back. I see something here. I'm going to apply gauze to that, tape that down, and then go ahead and roll him onto the backboard. Okay, we're going to further treat for a shock at this time by keeping him warm. He is definitely a rapid transport, and we're going to do our secondary assessment in the back of the ambulance.
You are now in the back of an ambulance. Sample findings are as follow. No allergies, no current medications, no pertinent past medical history. Last intake was about 2 hours ago for lunch, and he was cleaning his gun when it discharged. Wife heard the shot and says it was about 20 minutes prior to EMS arriving.
Okay, so I'm gonna get a set of baseline vitals and then go from there. While I'm doing his blood pressure, I'm looking at his respirations. Getting his heart rate. Gonna get a blood glucose level on him as well. Check his O2 sats and his end-tidal. So I have blood pressure was 110/70. His heart rate was 72. His respirations were 16 and they are not labored. His blood glucose level we'll say is 78, and we'll say his end-tidal is 40, and he's statin at 98% at the non-rebreather.
Your actual vitals are your blood pressure is 145/95, respirations are 30, shallow and labored, heart rate is 100 per minute, O2 sat is 89%, end-tidal is 50, and blood glucose level is 70.
Okay, so based on those findings, I need to switch him off the non-rebreather, and I need to initiate ventilations with a bag valve mask. So we're gonna switch from his non-rebreather. We're gonna take that off, we're gonna put on a bag valve mask, and we're gonna ventilate one every 6 seconds and see if that improves the his saturations.
Patient's O2 sats have increased to 98%, and end-tidal has dropped to 40.
Okay, so I'm gonna pass this off to my EMT assist, and then I'm going to do my secondary assessment, starting from the head, working my way on down to the feet. So starting at the head, we are feeling for any crepitus, deformations, any decap BTLS. We're going to check behind the ears for any bruising. While we're there, we're looking for any secretions or fluid out of the ears, any fluids or secretions out of the nose, out of the eyes, or mouth. Well, they're ventilating. We are checking the orbits around the eyes for any decap BTLS. We're going to check behind the neck for any step off. We're checking for jugular vein distension. We are checking to see that his trachea is midline and it hasn't shifted. We're checking for pupil response. His pupils are equal and reactive to light. Again, we're going to continue with our decap BTLS, checking the clavicles. The chest, we're going to palpate the chest, feel for any flailed chest. We're going to listen, make sure breath sounds are present. Breath sounds seem to be present and adequate on both sides. We're going to check further down the abdomen, 4 quadrants. We are going to palpate the area. Don't feel any rigidity or distension. We are going to check the pelvis for stability. Push in, push down and out. Pelvis seems to be stable. We're going to check the legs for any decap BTLS. Pedal pulse is present. Other leg, decap BTLS. Pedal pulse is present. And check the arms. Decap BTLS. Radial pulse is present. Other arm. Any decap BTLS? No. And radial pulse is present. Okay, so we are going to continue to reassess the patient every 5 minutes because he is a high priority patient. Last thing I'm going to do before calling the hospital is check the backside one more time. So at the count of the head at 3, 1, 2, 3. Okay, I'm checking that wound from earlier, see if it's bled through. If it's bled through, I'm going to put more gauze on there. No other injuries that I can feel, and the spine seems to be in place and there's no step off of the spine. Okay, so reassess every 5 minutes, high priority patient, and we're en route to the hospital.
That is the end of the trauma patient assessment and management.